Every minute, someone who feels they are okay, fine, dressed up for work and going to work, suddenly slumps and dies. There's no second chance, no hospital appointments. What exactly does this mean? Today, we're going to be talking about an important topic. We're going to be looking at cardiac arrest and heart attacks. Hi, once again. Welcome to Health Talk with Dr. Mo, a show where we keep it real, relatable, and rooted in facts. And today, I have an expert who is going to dissect it all for us and tell us exactly what we need to know. What is a heart attack? What is a cardiac arrest? Are they the same thing, or what exactly do we need to know? So I have with me, honorably, Dr. Hussein Hishmat, who is a professor of cardiology at the Cairo University. He holds a fellowship with the American College of Cardiology and the European Society of Cardiology and the Society of Cardiac Angiography and Interventions. He serves as a consultant interventional cardiologist in the UAE with an extensive experience of over 6,000 interventional procedures. So you can imagine that nobody can say it better than the expert himself. His expert lies in cardiovascular prevention, complex coronary interventions, peripheral vascular interventions, and heart failure management. He has been recognized with 4 awards in interventional cardiology in Egypt and the UAE and has contributed 50 international publications with over 1,000 citations. Currently, he is the associate editor of the Egyptian Heart Journal. Please welcome with me Dr. Hussein Heshmat. Welcome, Dr. Heshmat, and thank you for joining us on Health Talk with Dr. Moon.
Thank you, Moji, and thanks for giving me the opportunity. And I hope we say something that makes a difference in the lives of many people. I
Thank
really
you.
wish that.
Thank you so much, Dr. Heshmat. So, people who seemingly feel well, they dress up to work, or probably they're going about their daily activities, or they go to bed, suddenly they collapse and die. What is this? Is this a cardiac arrest or it's a heart attack?
Yeah, this is a tragic situation, and it has been happening since long time, but now we're noticing it and we're getting more aware of it.
Mm.
We call that sudden cardiac death. And sudden cardiac death has many reasons.
Mm.
And we can roughly classify them based on the age of the person who suffers this event, this tragic event.
Okay.
And the causes are different if someone is below the age of 35 or above the age of 35. So when we're speaking about someone who's above the age of 35, then the most likely reason is the heart attack. It's
Mm.
a sudden block in one of the big vessels that's supplying a sizable part of the heart, and then the heart stops. That's what we know as a heart attack.
Well,
There are other reasons, are less common above the age of 35. It could be some inflammation of the heart. We call that myocarditis. It could happen after a viral infection or other infections. Other reasons could be some diseases of the heart muscle. You know, the heart is a pump,
yeah.
and in order to pump, there must be a muscle that's contracting. So there are some genetic diseases of this muscle where it gets thicker and then it contracts abnormally and then the heart stops. These are the salient causes when someone is above 35. Below the age of 35, it's a little bit different and it's more related to genetic diseases. One of the most common is, again, these heart muscle diseases where there's hypertrophy of the heart. We call that hypertrophic cardiomyopathy. That's a genetic disease. Other genetic conditions could be related to the coronary vessels, not an occlusion, but an anomaly in their origin or in their course. They may be running an abnormal course, so they can get compressed while exercising heavily, and again, the person will fall down. Other reasons could be related to the electricity of the heart. You know, the heart is a pump, so it needs some electric stimulus so that it's stimulated and starts pumping. And this electricity is governed by some ion channels. You know, electricity is a flow of ions.
Yeah.
And if these ions get disturbed for some reason, mostly genetic, then the heart can go into fibrillation and then can stop suddenly. So
Mm,
above the age of 35, it's most likely a heart attack. Below the age of 35 could be a variety of genetic conditions, heart muscle disorders, anomalies of the coronary origin and course, and some electrical disturbances of the heart.
mm, mm. Thank you for clarifying that. So my next question is, are there signs that the body gives before the heart stops suddenly?
Yep. Yes. Usually in the previous days or hours, the majority of individuals can feel something abnormal, but
Mm,
they cannot always report it correctly or identify it correctly.
wow.
There could be chest pain, there could be a sense of fatigue, there could
Mm,
be some racing heartbeats, there could be some unexplained sweating or shortness of breath.
okay.
And these symptoms can go missed, and then the big event happens.
Wow. One of the things that surprises me is that people who are very fit, who eat the right diets, they exercise and all that, and then you hear, oh, they collapse suddenly and they die. What is the, what is, I mean, why does that happen? Because you would expect that somebody is fit, so the person should actually be immune, to a
Um,
cardiac arrest.
yes, we tend to overemphasize how healthy sport is and how protective it is.
Mm,
It has some protection, of course, when it's done properly, but when it is being overdone, that's a hazard. So,
okay.
what we recommend as a healthy physical exercise is 150 to 200 minutes every week of
What?
moderate intensity activity.
Okay.
And a moderate intensity activity is the one that's going to make your heart reach like 75 to 85%, or let's say 75% of the maximum heart rate for an individual.
Mm,
And how do we know that? There's a simple equation. If someone ages, let's say 50, 20, then 220 minus his age, then the maximum heart rate that his body can reach is 200. And moderate intensity activity is 75% of that.
okay. Okay.
And you take that by the age.
Okay.
And so that's one option, 150 minutes a week. Or if you're doing vigorous intensity activity, then roughly 75 to 100 minutes a week can be enough. And the
Mm,
vigorous activity or high intensity activity is where you exceed or you beyond 85% of the maximum heart rate for age.
mm,
So this is the sweet spot. Less than that, then you get some benefit, but not the best.
mm.
If you go beyond that, then as you move more and more, then the benefit diminishes and then you run into some risk,
Okay. Okay.
especially for those people who are sedentary.
Mm,
Being sedentary for a long period and then you decide to go suddenly into an intense exercise, we know that this is risky for the heart.
mm, okay.
So this is speaking of exercise in general. You need to be in the sweet spot.
Mm,
Why would someone who's apparently healthy suffer from sudden death, depending on the cause? Atherosclerosis can occur even in the individuals who exercise,
right.
if they smoke, if they drink, if they are not eating healthy food, if they have high blood pressure or high blood sugar or genetic predisposition, then they still can suffer from atherosclerotic disease.
Wow. Okay.
And we know in the football players,
Yeah.
the world athletes, I think the listeners and the audience would be aware of many incidents where professional athletes, they just dropped
Yes.
while in the field. We see that
Yeah.
in football or in basketball.
Yeah.
So this is most likely below the age of 35, and this will take us back to heart muscle diseases, disorders of electricity of the heart, or coronary anomalies, or inflammation of the heart.
Mm. Wow.
And of course, for those professional athletes, and also for everyone, there should be an annual screening for specifically for these conditions that can um, that can go unnoticed in someone who's completely healthy
Yeah.
and gives us this tragic scene. There must be an annual screening for those professional athletes.
Oh, wow. So, what is that one test that should be done annually for you to be able to say maybe you're at risk of or heart disease or not? Or it's an array of different tests.
Well, it depends really on the situation.
Okay.
For those athletes, we need to do two or three tests. Of
Okay.
course, after taking a proper history, inquiring about the family history,
Mm.
if he ever lost consciousness before, and the family history is really important about a similar condition in the family, and of course, a physical examination is essential. Then we look for the electrocardiogram and a transthoracic echo, which is an ultrasound for the heart, and we might complement that with a formal exercise test or cardiopulmonary test. This is for the athletes.
Okay.
For a regular person who has no symptoms, then again, a history taking and a physical examination are both mandatory.
Mm.
Then we try an ECG, of course, is the basic test.
Mm.
And then, depending on what we found on history and physical examination, we may go for an echo or a CT scan or an exercise test. And of course, for a regular individual, we need to check what we call the metabolic profile, a metabolic profile of an individual.
Yes.
And I think you're aware of that.
Yeah. Mm. Mm.
We like to check the blood lipids, the triglycerides, the cholesterol, the blood sugar, the kidney functions, the liver functions.
Mm.
And we incorporate this into and gives us an understanding of the overall risk of a person developing heart disease in the coming 10 years, or if the person has already a heart disease that was not previously diagnosed.
Mm. Wow. Thank you so much, Dr. Prof. So, in the event of a person suffering a cardiac arrest, what should the people around such a person do immediately? What is the critical moment for that person to either live or die?
Okay, that's more of a societal effort, more than an individual effort. For an individual, then I would recommend everyone to get a training in basic life support.
Okay.
We call that BLS.
Mm.
Is to get an idea on how to do, you see that in the movies, how to do a cardiac massage,
Yeah. The
or
CPR.
how to, yeah, CPR, or how to do mouth-to-mouth breathing.
Mm.
And there is a protocol for that. At least you can call 911. I mean, there should be an emergency number, especially in the football fields, in the soccer
Mm.
fields. There's always an ambulance.
Mm.
And if there's no ambulance and you found someone unresponsive, you try to make sure that he's really unresponsive. You check that the scene is safe first. Make sure that the person is really unresponsive. Call for help. Try to check the pulse if you can do that.
Okay.
And if you don't see a pulse, then it may be wise to start a basic life support.
Mm.
An important thing not to do is to gather around a person who's lying on the ground, just looking at him, staring at him, and
Mm.
not doing anything.
Anything.
Call for help. If there is an AED, an automated external defibrillator, this can save lives. It's a couple of pads that are placed on the chest, and they can analyze the rhythm of the heart and tell you if this individual can be saved by an electric shock, which the device would give on its own. So
Mm.
this is all part of the basic life support, which I think should be an integral part of the curriculum in schools and in the universities because it can save lives.
Wow. Thank you very much. I mean, you've pointed a very important thing that everybody should learn basic CPR because that is what can decide whether the person is going to live or going to die. And of course, one interesting thing I found in the UK is that every major sentence has a defibrillator.
Yes.
They have a boot with a defibrillator. And this can be replicated in Africa as well because I don't think they're so expensive that it shouldn't, I mean, it shouldn't be available. But the truth again is, in the days of social media where people are more interested in capturing content and looking, capturing somebody, they want to be the first to report somebody is dying rather than helping the person. It's becoming an issue now. People just stay there and stare, not trying to help. And just like you mentioned, I think it's a policy thing that should come into place as well. Um,
Well, we know that we know from the science that uh, taking it from the hospital side now,
yeah.
when someone arrives and he had a bystander CPR, then
Mm,
their chances of walking out of the hospital alive would be much higher than someone who was not resuscitated in the field.
wow.
So this bystander CPR can
Mm,
make a big difference in the life of a person.
mm,
And some people would be worried that they may harm a person, and this is very valid. But if someone has been trained in basic life support,
yes.
then they shouldn't worry of harm because there's also that famous rule, the Good Samaritan rule,
Mm,
where you will not be held accountable or legally accountable if you try to save someone's life and then some collateral damage happens as a result of that. So you should be safe regarding that point.
wow. Thank you very much, Prof. So, what are some lies people believe about the heart, and how would you clarify it?
They feel one of the biggest myth is destiny. Destiny,
Mm,
of course, is there, and as long as it's in my fate, then I will see it, and I cannot change it. So if it's my destiny, then to die at the age of 30, then I'm gonna die at the age of 30.
mm,
Well, this can be true, but uh, you can take it from another perspective. Let's look at the science. The science tells us that 80% of the heart, the death related to the heart or the heart attacks can be prevented or at least delayed
mm,
by adopting a healthy lifestyle, by doing your annual tests. So I know, and I don't want to be philosophical or going into religious debates, but taking care of health can make a big difference in the life of an individual. Eating a healthy diet, stopping smoking, doing some exercise, checking your blood cholesterol, they can make a big difference and they can give you a better life. If
mm.
they do not change your destiny, maybe the days remaining for you to live, you live them in a better way.
Wow.
So the biggest myth is fate and destiny.
Mm. Spot on. So, Prof, when we talk about heart failure, what are the signs? Because I know with heart failure, it's very easy to spot the signs before they get out of hands. What are the signs that people should look out for to show them that, look, your heart is whispering to you? And if you do not answer it, a bigger problem lies ahead of you.
Let's make it more general and talk about the symptoms of heart disease in general.
Okay, okay.
Probably the most common symptom would be one of three: a sense of breathing difficulty
Mm,
or pain in the chest or some racing heartbeats, and we can add to that fatigue,
okay.
inability to walk or exercise.
Mm,
So these are the four salient symptoms of heart disease: chest pain, shortness of breath, racing heartbeats, and inability to perform exercise because of fatigue. If you
Okay.
have any of these, sorry, if you have any of these, then try to see your doctor.
Mm,
Even try to see a nearby GP. I know
okay.
if our audience is from Africa and access to healthcare is not easy, then at least try to see a GP. Or if you feel that the symptoms are severe, then you'd better go to an emergency department. Everyone now has a cell phone, a mobile phone,
Yeah.
and they have one of these large language models. So if the symptoms are mild, you can ask your AI,
Okay.
give them a detailed explanation of your symptoms, and they can help you on where to go and how fast to go.
Okay.
So these are the main symptoms of heart diseases. And these four symptoms could be due to block in the coronary vessels, could be to a problem in the heart valves, or a problem in the heart muscle, which you pointed out as heart failure.
Mm. Wow. Thank you so much, Prof. So, if you could give one life-saving advice or message to our audience, what will it be?
Okay, if you need something that's quick and effective and touches a big proportion of people, then it's smoking.
Smoking. Mm,
Yeah, whether it's the regular cigarettes or the electronic cigarettes, and especially for those individuals before the age of 50,
mm.
because we know that a big proportion of heart attacks come from smoking. And if we eliminate smoking, then we'll be able to cut 40 to 50% of heart attacks at this age group.
Wow. Mm, wow.
I think
It,
this is easy and
yeah,
very
I mean,
applicable.
it's interesting how something that little can make a
Yeah,
big difference, you know.
yes,
And what I've found out in medicine is that a lot of times the big issues that we have stem from little habits that we do not indulge in or habits that we indulge in. So honestly, thank you so much, Prof, for enlightening us. I mean, spot on, clear, and and for our audience, we hope that you've learned one or two things. And of course, as doctors, we want you to live. Yes, we make money from you coming to us, but of course, we also want you to live and have an extension of life. So if you found this useful, please subscribe, share.
let me, can I
Okay.
add something on that
Yes, please.
about doctors making money from from people? Well, if you look at it even from a pragmatic aspect,
Yeah.
if someone dies, that's a loss. That's an
Yes.
economic loss
Yes.
to the person himself, to the family, to the
Yes.
community, and even to the healthcare providers.
Mm.
When we lose someone, this is a tragedy. We get traumatized
Yes.
every time we lose someone.
Yes.
And even we call this in the healthcare quality, we call it the second victim.
Mm.
So the first victim is the individual himself,
Yes.
and then the provider who was involved in that tragic event is also a victim. So we get more money when people become healthy.
Healthy.
Yeah.
Yes, I agree with you, Prof, because let me confess to you, one of the things why I moved away from clinical medicine was because I was always traumatized when I lose a patient. And it's always very painful, just like you said, first victim, second victim. But it's always more traumatizing when you do everything within your power, humanly possible, to save the patient, and yet you lose those patients. But people don't understand that we also have feelings, They say like, oh, they think doctors that our feelings have been deadened because we've seen a lot of dead people. But they don't know that behind the scenes, we also go back, we reflect on life, and we also feel the pain as much as the people, the first victim as well. So honestly, you said it well, spot on. So dear viewers, I will want you to subscribe so that you can hear more practical tips on how you can stay healthy. We really want to have you alive. Prophet said it. We want you alive. We make money from you being alive. I mean, and of course, behind every death is somebody's father, somebody's mother, somebody's son, somebody's sibling, a
Yeah.
breadwinner to the house. The pain strikes us as much as it strikes you, if not double, because we always want to see you smile. Our joy is always to see your patient come around and say, Doctor, you can't remember me. You saved my life. It's always it's always very soothing, right? So please take care of yourself. Yeah.
Saving a life is the most gratifying
Yes.
thing that a doctor can
Yeah.
feel and can achieve.
I agree.
Forget about everything else.
Sure. Very
Bringing a man back to his family,
mm,
a father, a brother, a son, a mother, a daughter,
mm,
is the biggest blessing in this life.
I agree with you. Thank you so much, Prof. Thank you very much. I know it's a fasting period and I've taken you out. I know. Thank you so
It's
much.
my
We
pleasure.
really appreciate you. And hopefully, we can always come back to you again when we have
Sure.
questions and also other topics that will be of interest to us. And so, this is where we call it a day, dear viewers. Please and please, we want to see you alive. If you found this useful, please subscribe. Please share with your friends. You might be saving a life. It's not always information that it's not always nice when you have information and you hoard it, especially one that you think can save a life. And please, I want to appeal to corporate bodies. Start training your staff on basic life support so that if anything happens in the workplace or in public places, the first few minutes they can save that life. Just like Prof said, the difference between someone coming to the hospital and walking back out is what the bystander has done to save the person's life. So see you on the next episode and bye for now. Take care.
Thank you. Bye.
Thank you.